you're good to go.
All right. Well, thank you everyone so much for being here. As I said, I just graduated pharmacy school back in 2017, so I'm still relatively new, a new employee to the workforce. So I understand about the being demands as a student. But my name is Lieutenant Commander Gavin OBrien, and I'm a member of the United States Public Health Service Commissioned Corps. Today we will be. Our three objectives are going to be to describe the United States Public Health Service Commissioned Corps and the application requirements. Secondly, we will list potential roles and opportunities for public health and health administration officers in particular. And also then we will talk about and explain what a U.S. Public Health Service Commissioned Corps career path could look like. And as I mentioned before, I said, please feel free to either post questions in the chat. We'll definitely have some time afterwards as well. So, all right. So to start, I just wanted to go through just some general points about the U.S. Public Health Service Commissioned Corps. Our motto is in officio solidis, or in the service of health, and we were actually created back in 1798, so over 200 years ago. And we're overseen by the Assistant Secretary for Health. We can be found within the Department of Health and Human Services, and the U.S. Surgeon General is actually the top position within the U.S. Public Health Service. And just a little bit about our leadership structure. Dr. Rachel Levine was the Health Commissioner for the state of Pennsylvania prior to joining the Biden-Harris administration, and she actually oversees the U.S. Public Health Service Commissioned Corps. Her rank is a 4-star admiral. She's actually the first trans person that is a 4-star flag officer in any of the 8 uniformed services. And as I mentioned before, we also have the Surgeon General, which is pretty much known as America's top position. And Dr. Vivek Murthy is the current Surgeon General. His areas of focus are loneliness as well as pediatric mental health. Now, so who we are. The Commissioned Corps of the U.S. Public Health Service is one of the 8 uniformed services. And I'll just try to clarify a little bit because it can be tricky to hear the word uniformed and military and different things, but uniform doesn't really means that we don't carry weapons. And our role is exclusively about public health. So that's why we thought it would be nice to present to you all. But we are about over 5,000 public health professionals strong, dedicated to addressing public health emergencies, projects, as well as providing clinical care. Our mission and values is to protect, promote, and advance the health and safety of our nation. Our 4 main core values are leadership, integrity, service, and excellence. And as I mentioned before, the Public Health Service, this shows the various branches of the U.S. military. And the Public Health Service is highlighted in the middle, but we are underneath the Department of Health and Human Services, not the Department of Defense, Department of Homeland Security, which is where the Coast Guard and a lot of the other armed services are found. Now, what do? We provide essential health services, especially for the vulnerable and underserved populations. We serve on the front line of public health emergencies. We also lead public health programs and policy development, and we advance innovation and science. So here just shows a little bit, as well as the following slide, about we serve in over 800 locations, all 50 states, as well as numerous international assignments, including the World Health Organization. Now, as you can see, that the first bullet is like underlined for the Department of Health and Human Services, and that's where a majority of the officers are currently stationed or serve within. But we have officers all throughout Department of Commerce, Department of Agriculture, Department of Homeland Security, along with state governments, tribal and local agencies. One thing I'll just mention here, and I'll plan on expanding on like a little bit more as well, is within the public health service, it's kind of a little tricky to first like hear about, but you basically have two different jobs a little bit. So you have your job as an officer within the public health service, and you have the requirements that are expected and the duties of that. But then you also have your job, like for me, at the FDA or the Food and Drug Administration. There's like many people also work for the Indian Health Services, the Bureau of Prisons, or the National Institutes of Health. So here's just one other slide that shows a little bit more information about the various agencies. But you need to have both of those two things. You can't just be a member of the public health service and not have an agency or like primary area if you wanted to serve within like the regular corps. We'll talk about the Ready Reserve a little bit, which is slightly different. That's just kind of started up recently. But for like regular, or I guess the average officer, you need to have your normal agency within the government, and then you also have the expectations of being a public health service officer. Another couple agencies that you may or may not have heard about is the Centers for Disease Control and Prevention, the Health Resources and Services Administration, among others, as well as the Immigration and Customs Enforcement. So now we'll kind of transition to the emergency response and emergency response deployments here. So, and as I said, feel free to ask questions as well. Here are two pictures. One shows a very large gymnasium that where people were staying following one of the hurricanes down in Texas. So this is a like logistical deployment mission that we need to just make sure the patients' basic needs are taken care of when they're significantly displaced due to natural disasters. And then the other image is actually a picture of the USS Comfort. It's about 1,000-bed hospital that is a very large ship that can support health crises as well. So some of the possible deployments that the Public Health Service has supported is COVID-19, as you all may guess, hurricanes, other natural disasters, Native American missions, international missions, as well as other missions. So a couple of the deployments I've personally served was with the unaccompanied minor mission, or unaccompanied children's, where there were a lot of children crossing over the southern border, and we wanted to make sure that they were going to be reunited with their families here. Excuse me. And then so that was a fantastic mission where there's so much intergovernmental collaboration. There were a lot of other agencies also supporting. FEMA was there, along with many other areas too. And then the last deployment was last year for me, when I was supporting Operation Allied Welcome, and that was right after Afghanistan, when the Taliban took over, and we supported the U.S. allies in Afghanistan to come over to the U.S. And that was especially a COVID-19 mission, because we wanted to make sure that the guests were not going to get sick with COVID-19, and we were following proper infection control procedures. So those are just two examples of possible deployments that you may be able to take part of. So how could I be asked to serve? As we kind of mentioned already, there's domestic as well as international operations. One of the biggest things I'd say is just to be flexible, because you never really know what kind of deployment you'll be supporting. But just having like the skill set and completing all the training that you can, I think is really helpful. Along with having like mentors as well that you can ask and just say, hey, can you help me out a little bit here? That was super helpful for me. Also, like humanitarian assistance, disaster relief, and supporting administrative, logistics, and operational areas of the mission. Whether or not your background's clinical or not, there's so much important factors that people may not think about it when it comes to deployments that are really critical for the mission success. And for the COVID-19 response, we had over 4,500 officers deploy, and there were 200,000 deployment days. So that just kind of shows the level of scope that we helped support. And here's just a couple pictures. We supported in the leadership, operations, screening, quarantine, case management, and human services. Now we'll just transition a little bit to talk about requirements to getting commissioned. So a couple of the major ones are: you need to be a U.S. citizen and less than 44 years old. You need to have a qualifying degree from a accredited institution. And just in case anyone's curious, the Masters of Public Health program at Old Dominion University is CEPH accredited. So you all are in luck, which is good. There's a background check, and like as I mentioned previously, you need to obtain a qualifying position within like the federal government. And there's also a 8-year contract if you start within like regular Corps. And then on top of that, there's also minimum height and like weight standards, as well as a medical qualification process, similar to the other agencies as well. Excellent, thank you, Amy. Yeah, it's actually 44 years old, and there might be like a way to increase it a little bit if you have prior military experience. So let's say you had 5 years of military experience. I think it might be 49, because that can be added on. I believe it's a matter of like you need to have served 20 years by the time you're 64. I think there's something like that. So 44 is the general cutoff, but there may be changes. But thank you for your comment. All right, so next slide is qualifying occupations, and this is only like a partial list, but I just thought I tried to select the ones that may have the most relevance. Especially, I tried to underline and bold them that are kind of related to masters in public health or kind of public health background or masters in like healthcare administration. So, and then also like I heard about the like environmental health officer. I probably should have like bolded that one too. But clinical psychologists, social workers, dental hygienists, dietitians, environmental health, healthcare administrators, healthcare information management, or as well as health informatics and medical health record administrators, as well as public health professionals are all some of the possible occupations or careers that public health, U.S. Public Health Service supports. And the qualifying degrees, healthcare administrator requires a master's degree from a CAHME accredited program. Health informatics requires a bachelor's from a CAHIIM accredited program. And then a medical health record administrator is a bachelor's degree from a CAHIIM program, along with a information and administration certificate. That the expectations for that is that there would be a continuing education required with that certificate as well. And the public health professional is a master's or doctoral degree from a CEPH accredited program. Now, some application advice. I've included my contact information, my personal cell phone, and then personal email. So feel free to reach out if you're interested, or if you know someone who wasn't able to make it today, but like would like some more information. I'd be happy to help myself or put them in touch with somebody who they can provide more or direct answers to their questions. I think being detail-oriented, persistent, and flexible is really critical. Within like the government, there's lots of paperwork. So if that's something that's a problem, I would say that's going to be a little tricky for you. And also, like, the process has been a little bit better. Let's see here. Thank you. Yeah, that sounds great to share with other students. But yeah, the process has been much smoother as of late, I believe. For me though, there was a couple requirements that I had to submit multiple times. So that's where I think just expecting that there's going to be a little bit of hiccups in the process. If not, great. You definitely had positive luck, and really happy for you. But I think not expecting it to be like 100% perfect is probably reasonable. And just reaching out to people, I think is really like the number one thing that I would bold, because when I applied, I guess I didn't really know like too many people. There was someone similar to me that spoke to like my college, and I asked him a little bit, but I didn't want to bother him. And I realized now, like I've talked to him many times since, that he would have been really helpful if I would have asked. But I think that's just talking to people who have already done it is really beneficial. So that's just my 2 cents. Feel free to reach out anytime. Now, civilian versus the U.S. Public Health Service. So I just wanted to have this slide because you can, I guess, in order to be within like the public health service, as I said, you have to have those 2 things. You need to apply to the public health service and get accepted through all their process, and you also need to get accepted for a federal position. And you can work within the federal government without being an officer. Most of the government is a civilian. But I wanted to kind of explain a couple points why I personally chose to apply for the U.S. Public Health Service. And the biggest reason was to support national deployments, national emergencies, and like be available when people really needed us. Civilians are not expected to deploy. There's sometimes opportunities within volunteer opportunities kind of thing. I guess I'll be honest, I didn't know that at the time when I was applying, but I really liked the idea of serving in really difficult scenarios and just helping people, because that's really like important mission. Also, like the public health leadership over the last 200 years and the experience that the public health service has was really appealing, as far as being able to learn from so many incredible people and have just a built-in network to support. I couldn't have been more appreciative at the start of my career. Also, within the public health service, they expect us, and they kind of require in a way us to continue our education, training, show impact, and really desire to be like a lifelong learner. I found that a lot of times the agencies will support us, so we don't have to pay any money ourselves out of pocket for additional education, training, and I just really enjoyed like that side of things. I've always known that I'm a bit of like a nerd when it comes to school and stuff, and I just thought that I desire to be like a lifelong learner. Public health service really pushes us in that way, and like that wouldn't be too big of a stretch for me. And lastly, my experience actually back in high school, I went to a military high school. So that experience helped me. We had like uniforms and kind of was exposed to the military structure. So I didn't feel like intimidated by that too much. My girlfriend, on the other hand, she's also a public health service pharmacist as well. She has no prior military experience, and most people don't, to be quite honest. So it's definitely not a deal breaker, so to speak, but just getting into the habit of cutting your hair, shaving every day, putting on the uniform. That's really I guess a little bit of a change for some people, but not too big of a deal, I'd say. And I guess that's what she says sometimes too. So now just a little bit of like the rank overview. I don't know if you can see, it's like the screen might be a little bit tricky here, and I apologize, but so the biggest ranks that we have, or I guess like the most common ones, these are all officer ranks, which for anyone like familiar, there's just 1 second here. I'm so sorry. Sorry about that. I'm just in a hotel room, and I'll be checking out late. They were just confirming. Whoops. But so these are like the ranks here, and these are the officer ranks. And I just wanted to make a comment that in all of the other services, Army, Navy, Marines, they have officer and like enlisted. Within like the public health service, we actually only have the officer ranks, which is kind of unique. It's honestly nice as far as compensation a little bit too, and pay, which is helpful. But the ensign is like the first officer rank, and then it goes lieutenant junior grade, lieutenant commander, which is what I am currently, and then we have commander, captain, and then rear admiral is like the really high up people. And then most of you may start as either a lieutenant junior grade if you were to apply, or lieutenant, and there's pay calculators online. I'll show a little bit of the pay that I had last year, just to give people helpful kind of expectations. But depending on like your education, training, or if you had prior military experience, that would be really what would determine which rank you would start off with. Now, as I mentioned previously, the Ready Reserve Corps was just created within the last year or two, and the mission here is to provide trained and ready personnel to fill critical public health needs, but not need to be within the federal government. So what's nice here is that if you didn't want to work for one of the agencies, but still wanted to serve and deploy and help within crises, you could apply to this opportunity. And there's general expectations for training at I think it's either monthly or quarterly to go and complete various trainings. And in this, like, the benefit here too is that like you all, or the people within like the Ready Reserve Corps could possibly deploy instead of the people serving in maybe hard to fill areas. So because I know myself, I served within the Indian Health Services, and we were a pretty rural, remote area. And sometimes you might be the only healthcare provider like working on a certain shift. And like the Ready Reserve Corps is just an extra little buffer to make sure that we can support the mission needs. Now, some possible career paths. We'll go in a bit of detail about Masters in Public Health opportunity, which there's certainly many different things that you could do. This is only one. Masters of Health Administration, along with my own personal career path as well. So the Masters in Public Health, this is just one person's journey, as I said, I think the biggest takeaway from my experience within the public health service so far is that your education and training is like very helpful, like, and important, but also the opportunity to apply your skills in different areas that you may not have thought about is really incredible as well. So this officer started as a performance improvement officer within the Indian Health Services, and really focused on smaller projects to really like adapt like a project management focus for various public health initiatives. And after doing that for several years, they progressed to a quality manager also within the Indian Health Services. And the skills that they've cultivated are data analysis, quality assurance, team building, report writing, as well as regulatory compliance. So this is just one example of someone's career path within the public health service. And someone who had a master's in healthcare administration. You could probably flop these because there's probably a good bit of overlap as well. But this is just another example. Is they started out as a program management officer within the Food and Drug Administration. They started on the Office of International Programs, and especially was helping out the head executives to make sure that the deliverables were being tracked, and monitored. Then they pivoted into an information technology or kind of an IT project manager role, and they were specifically focused on creating and implementing a project to support various software of the like FDA staff members. And now they're currently working on a FDA-wide implementation initiative, which the FDA has about over 15,000 employees. So to start off and to just continue their knowledge and skills, one of the things that the officer here said to me was about the importance of learning contracts, because there's so much contracts within the government. And if you can get training to be a contracting officer representative, it's sometimes called CORE. She said that's been incredibly helpful for her career, and just really emphasized that the constant training and learning is really, really helpful. Now, I just wanted to give a little bit of background about me. I told you all that I graduated from my pharmacy school back in 2017 in Albany, New York. I've actually completed a global health engagement certificate through the Uniform Services University, and that was completely free. So that was really, really neat. That it was really reduced tuition, and just I didn't have to pay anything personally. And now I'm actually taking classes for a Master's of Science in Applied Psychology at Angelo State University. I think psychology is so critical for leadership, for designing programs, and I'm about halfway through like that program. But it's been really fun like to learn. So I really have been like enjoying that. As far as my duty stations and kind of my jobs over the last 6 years, I started as a staff pharmacist for the Indian Health Service within Chinle, Arizona, right near the four corners. Then I went to Belcourt, North Dakota for 3 years and completed a pharmacy residency. And then following the residency, as well as 2 years of clinical practice, I then transitioned last year to the FDA, or the Food and Drug Administration, specifically the Center for Tobacco Products, as a health scientist. And I supported in the medical review process, and now I'm supporting in project management, process improvement, and technology implementation. So a little bit of a varied career path, but I'm really, really enjoying it. That's for sure. So, so just a little bit about my time in Chinle, Arizona. I absolutely loved it, and I felt like the Navajo people were so incredibly welcoming, kind, and generous. I'm not Native American at all. But within the first month of me joining, of physically moving out to Chinle, I was invited to people's birthday parties, and we had get-togethers and hikes and different things like that. I just felt really, really like at home. And just, I guess, a little bit of background. The Navajo Nations covers area in Utah, Arizona, and also on New Mexico, and the reservation size is about the size of Westlake, Virginia, which is pretty large when you think about it, especially in comparison to a lot of the other reservations throughout the U.S. Unfortunately, the infrastructure is so much less than really anywhere like in the country. The amount of paved roads, like the miles of paved roads in West Virginia, might be around 20,000 miles. Meanwhile, the amount of paved roads in the whole of Navajo Nation is about 2,000. So a lot of patients lived on like dirt roads, and when it was snow and rain, they would have a lot of difficulty even just getting to the hospital. It was really rural, and the closest Walmart was about 2 hours away. Closest airport might have been about 3 hours away. So it was a completely different experience. But because of that kind of relative isolation, I felt like the Navajo culture was actually able to flourish a bit more than my time in Belcourt, North Dakota, because there just wasn't a whole lot of influences outside. Almost everybody spoke some Navajo, and a lot of people spoke fluent, and possibly like Navajo was the only language that they spoke. But there were definitely some cultural differences besides the language about eye contact. Eye contact was seen as kind of rude or like not necessarily appropriate. So that was something that I had to kind of train myself a little bit. People weren't like super upset. It was just something that I just wanted to do, to try to be a little bit more respectful of their culture. And also, as a pharmacist, I would be counseling patients as far as with like medication sometimes, and how you spoke about death was actually something that's was a bit of a tricky topic, because if you even said anything had a chance of death or different things like that, the expectation or the kind of feeling in their culture was that you were almost wishing that they would die. So that's really not what anybody wants to do for their interactions. So, but like that was something that was part of our training. And I just, as I mentioned before, I just had such a great time with friends and colleagues in the area. It's a beautiful area if you've never been. And so on the left, you can see a picture of myself and colleagues at Arches National Park, because I love to be outdoors and hike. And then on the right is also a picture of a bunch of us colleagues, along with the older gentleman in the middle. So I think at that time he might have been 95, and he was a Navajo a code talker, actually. And for anyone who doesn't know, because I wasn't very familiar when I started, the Navajo was actually asked by the government within World War II to create a code that couldn't be broken by the enemies. And he was one. John Kinsel Sr. was one of the oldest Navajo code talkers. So I was invited to his like birthday party, which was a really incredible experience. Then I transitioned to Belcourt, North Dakota, which was a much smaller reservation. It was only 6 miles by 6 miles. So that, if that tells you a little bit of the change. And it was on the Turtle Mountain Reservation, or Turtle Mountain Band of Chippewa. Some couple site details about like the pharmacy or the hospital in particular. We did about 800 prescriptions a day, so pretty busy. And there was 28 bed hospitals, so not really much smaller than places you would find really elsewhere. But we had about 18 pharmacists, and I had a really great connection with coworkers there, as well as management. I felt so supported, and I was able to live like, I don't know, 200 yards away from the hospital, so I could just walk into work every day, which is also a really nice perk. And as I mentioned previously, there wasn't as much I feel like cultural exchange necessarily, and like as far as the language or just different practices within Chinle, people talked about various things quite a lot. But in Belcourt, it was a little different, as I think just because there was a lot of non-native places around, so the language really kind of was like diluted a little, which was a little bit sad. And here's a couple pictures of some students in Belcourt. We had a pretty robust student program. We would always have students come through. So it was really great to allow them to work on some projects and also support us and see, I guess, really see how their experiences were within the Indian Health Services. And here's another one back in the snow. And then lastly, my current role is actually with the FDA, so the Food and Drug Administration, as I mentioned, with the Center for Tobacco Products. I started out as a medical reviewer, and I was especially focused on the e-cigarette products to evaluate the health consequences in comparison to combustible cigarettes, or like usual cigarettes, so to speak. But then I transitioned to the knowledge management branch, which, as I mentioned, I don't really have any specific training for it, but I had collaborated with some colleagues in the area, and they actually encouraged me to like apply for that job. But our focus is really process improvement, education, and technology implementation. So I've been really enjoying that. But I just wanted to encourage you all to not let the job requirements really be like a limiting factor, and just like connections is really important. Supporting people however you can, and just kind of letting your career go based on interest. So, and now we'll just give a little bit of an overview about the FDA. There are many different centers, and as I mentioned, there's almost 20,000 people. I think 17,000 people may work, which is pretty incredible. Some of the areas are centers for food safety, centers for drug evaluation, centers for devices, biologics. They're kind of like the insulin medications or other things like that. Centers for veterinary medicine, centers for tobacco products, and then toxicological research are the main areas. Now, some opportunities. We have regulatory project managers, so they make sure that the various products, whether they are tobacco products, drug products, devices, they make it through the regulatory process and in a smooth and efficient manner. We have medication error as well as epidemiologists, and that's something that I think is really neat to understand, like how medications are being used inappropriately and try to design them better. Training specialists, which is kind of like what I'm doing right now. Information technology, there's lots of opportunities within that, along with many more. So, but some of the common themes that I've found are that writing and reading are especially critical for almost any job. So that's something, if I guess as you're going through a school now, that would be my suggestion to try to focus on. I know I tried to focus on that, but I definitely still can always improve on that area. And then also for public health opportunities in particular, I think the Health Resources and Services Administration is a fantastic place as well. They support the federally qualified health centers, which are areas in underserved locations to make sure that they are providing effective and high quality healthcare. There's the Ryan White HIV/AIDS program to try to improve access to really life-saving medications. There's the 340B hospital program that supports lower income patients whenever there's a certain number of patients who are receiving Medicaid or income eligible. They provide discounts on the medication cost. There's Office of Health Equity, as well as loan support for healthcare providers. And I just wanted to give a one slide information about the kind of compensation or like money as far as like officers pay. Now this is for me last fall, and the pay changes based on where you live. That's the basic allowance for housing, as well as like your current rank as well. So I was a like 04 or a lieutenant commander. So that would be different from what you all would likely start out with, as well as the number of years of service. It changes as well, but it just gives a little bit of background for like anyone's reference. And as I said, I'd be happy to answer questions. If you were to live in say DC or like Virginia area, that's a much higher cost of living than say Belcourt, North Dakota. So your pay would be substantially higher than mine was, with the same criteria being the rank and years in service and things. So I just wanted to pivot a little bit to the student loan support, and I tried to there's other opportunities, not just the ones that I'll show here, but some of them are kind of clinical focused. So I wasn't sure how many folks on this call would be eligible. But feel free if you have a background. I saw someone, I forget who it was, who has the nursing background. So feel free to let me know. Christy, I think it might have been you. But yeah, just I guess let me know if you are clinicians and want some more some more knowledge about that, but I wanted to focus on ones that may be helpful too. Yes, then, Christy, thank you. Just for anyone who are clinicians as well, there's the HRSA substance use disorder program, and that actually it's not included here, but that can be about $75,000 or up to like 100, I believe, for like a three-year contract. Some of these ones here are the Indian Health Service student loan repayment program has just increased its expectations to be about $50,000 for like a 2-year commitment. And then there's also the Public Service Loan Forgiveness Program. And I also have a excuse me. I also have a friend who works up in like Alaska on a tribal reservation, and she's able to get pretty substantial student loan support as well. I don't know the specifics, but I'd be happy to connect people if they're interested, like moving up there. And then, as I said, the Public Service Loan Forgiveness Program basically takes about 10 years of qualifying monthly payments. But then after that, the loans are forgiven. There's definitely a lot of things to consider with this. I'm not certain if you have to pay taxes on the loans. I can't speak in incredible detail for these, but this is a huge, like the financial piece is a huge consideration, and personal finance is something that I'm very interested in. So please feel free to reach out if I can support anyway in this with these things. So the last couple slides here, thank you for bearing with me, and please let me know what questions you have too. So our 3 main areas to get started if people are interested to apply is to visit usphs.gov, review the medical standards as well as the applicant checklist, and then feel free to apply. And here is going to have a little bit more detail about creating your account, starting like the pre-screening process, submitting the required materials, and then there's a few different steps. We have an interview expectation. There is a medical review, and then there's the background as well as nomination clearances, along with seeking employment opportunities. So that's a very important factor as well. And lastly, just a couple of the benefits are listed here about joining the U.S. Public Health Service. I've personally had an incredible time within the Public Health Service. I've been in for about 7 years. I've been supported by so many incredible officers. The post 9/11 GI Bill has been really helpful to reduce education expenses. There's the housing allowance, which is tax-free. There's the student loan programs. There's a pension and 401k style retirement plan, along with 30 days of paid vacation each year. There is the expectation to be available and to deploy as well. So there's definitely duties and responsibilities associated with these benefits, but just wanted to include them here too. So thank you so much for watching and for listening today. 2 acknowledgements. I want to send my appreciation to Commander Jerry Z and Lieutenant Commander Diane Richardson for their support and help with creating this presentation. And then I'll keep my contact information here, and I'll also include it in the chat. Please let me know what questions anyone has. Thank you.
So I guess I'll go first. So since I'm already working with the FDA and I have gotten assurance that I will transition full-time after graduation, so yay. Does that make the process easier then? Because I don't have to try to find a career with federal government as well? Like, how does that transition work, and how do I broach that subject with my boss?
Yeah, no, that's excellent. Excellent question. I have several colleagues who have converted similar to what you're saying. And I think that it makes it honestly a lot easier because the process you don't exactly know how long the public health service part of the process will take. Or at least I don't think anyone can really give a super defined answer or a clear answer. So having a job that you're already doing that qualifies for one of those parts, it allows you to do that job for say 3 or 6 months as you're waiting for like the various forms to go through and different things like that. So yeah, I think I would definitely have a conversation with your supervisor. I know when I was within the Indian Health Services, it was tricky because we were kind of like shorter staffed, so I didn't have the opportunity to like deploy too much. But the public health service understood that because of just like the expectations there. But I just think discussing like with your supervisor your interest, and kind of feel free to share this PowerPoint or just share slides or anything you want. I think would be a really great starting place. But congratulations, Amy.
Yeah, no, I gave up the dream of being public health service because I thought I was too old already at 38, but turns out 44. That makes me a very happy individual.
I'm glad I could explain. Thank you.
And I also had a quick question for Dr. Taylor, or sorry, Dr. Brown. Is there an accreditation with the BSPH program?
So we're actually working on that as we become a school of public health. Hopefully in the next year or two, we can say we are an accredited Bachelor of Science in Public Health program.
Okay. I was just thinking because I know early on in the slides, we were talking about the accreditations required. So I just wanted to see if we had those yet or how that was going. Thank you.
Mm-hmm.
And does anybody else have any more questions? If not, thank you for coming today. It was very informative. I mean, I'm a very happy person here. We've got a lot of thanks in the chat as well. And I will pass on your contact information to the Public Health Student Associations for anyone who might be interested in the Uniform Public Health Service. And we will post this to YouTube so everyone can enjoy this presentation. Thank you again. Let me
Yeah, that sounds great.